Cancer Guidance by Type, Part 10. Dr. Dilip Gadgil, Pune. Colon cancer. Another important type of cancer is colon cancer. The CA19.9 and CA, carcinoembryonic antigen, markers are useful for colon cancer to a certain extent. Generally, the condition begins with the discharge of blood via stools or acute stomach pain. Colonoscopy and biopsy are done to diagnose it. Now, if a certain portion of the colon is affected, it can be removed via surgery. An anastomosis is done to create a surgical connection between the two ends. However, if the disease grows bigger, chemotherapy is suggested by doctors. From Ayurveda's point of view, it is critical that the root causes are identified and avoided. Eating excessively spicy food regularly is a common cause of colon or stomach cancer. Colon cancer can happen at any age. Patients generally come to us for consultation after undergoing surgery or chemotherapy, when there is very little left to do. However, it is possible to extend the patient's life and enable them to live happily. Let me give you a bizarre example. A 29-year-old married man was diagnosed with colon cancer. He was operated on in Pune. His wife knew about me and she asked the surgeon if they should consider Ayurvedic treatment, for which he vehemently dissuaded her. The patient's cancer relapsed after a year. They went to Tata Hospital in Mumbai and spent Rs 11 lakhs on chemotherapy. 6 months later, cancer relapsed yet again. The doctor said this was bound to happen because chemotherapy didn't really have a curative role to play here. The patient and his wife were both educated, and upon hearing this defense, they were infuriated. They asked the doctor why they were asked to undergo all these procedures if they were of no use. The doctor said that they had only 2 options, surgery or chemotherapy. So, they simply went ahead with it. Now, the patient's condition was deteriorating and the doctors sent him back to the first surgeon. This doctor opened him up and it was found that the patient had developed an intestinal obstruction. Neither did the surgeon manage to deal with the intestinal obstruction, nor was he successful in removing the tumor. He simply stitched his stomach back and said there was nothing he could do. When the patient's wife asked him if they should now seek an Ayurvedic expert's advice, the doctor said that there was no hope left now. The biggest problem was that the patient was brought to me very late, and while I tried my best for 8 to 10 days, he still passed away. Now, the doctor in this case was totally clueless about Ayurveda, so on what basis did he tell them to not consider Ayurvedic treatment? This is an important question.